Hello, my name's Unity Stoakes, co-founder at StartUpHealth, and today we've got a check-in with health transformer Christopher Jew, who is the CEO and founder of Caregivers Insight. And we're going to get an update on the Caregiving Moonshot as well as all the exciting updates going on. They've made a lot of progress this year, and we're going to talk about how they're entering 2026. So stick around for a conversation with the founder of Caregivers Insight, Christopher Jew, and one of the founders of our Caregiving Moonshot.
Great.
And it's accelerated.
I got to get this on tape here. It's so good. You're talking good stuff I want to hear.
Yeah, no, I think it's been truly transformative for us from the standpoint it talking to other members in different areas across, because caregiving crosses, we talked about this yesterday, and I mean, it crosses so many disease states. But more importantly, we've been able to get honest, candid discussions that has allowed us to accelerate our focus and refine our focus very quickly. That would normally take months, if not years, to literally weeks, 2 months on the outside. So I think it's really allowed us to improve our go-to-market strategy. And I think that's says a lot about Startup Health and the impact that it's making.
I appreciate that. Let's jump in because I'm here with Christopher Jew, who is an amazing health transformer in the Startup Health community, one of the leaders of our Caregiving Moonshot, and really just doing extraordinary work. We wanted to jump back on and really talk about some of the amazing progress you've been making, but also the important work going on with the Caregiving Moonshot and the need, because as you've been educating our whole community on, there's what, 60 million plus, 70 million plus caregivers in America alone. And this is a big deal. First of all, welcome back. How are you? And what's going on over at Caregivers Insight?
Unity, it's always good to be with you and talk to you. It's very inspiring. Things are going well. We're moving quickly at an increasing rate. And as an entrepreneur, you have to love that. We're always impatient, but the rate at which things are moving for us is extraordinary. From a development standpoint of our app, we've done some new UI UX changes based on some of the feedback we've had from others, but refining our focus in our go-to-market strategy, thanks to all the members, many of the members of this Moonshot that we've been talking to.
Remind the world what your mission is and what you're focused on at Caregivers Insight.
Yeah. We at Caregivers, myself, Thomas Moore, and I, our focus is empowering caregivers, family caregivers, or any caregiver for that matter, with mobile tools to document, monitor, and guide their care. We're leapfrogging the paper forms and written summaries that everyone uses to guide their care, which we found over many interviews, discussions, and research, they're not as useful as a tool that we've provided that gives you visualizations so that you can share with your team and take action sooner and reduce hospitalizations, utilizations, and things like that.
And a caregiver could mean a family member, a sister, a brother, a child, an aunt, uncle. Give us a little insight of how expansive caregivers are. A lot of people don't realize until they're in the situation where they become a caregiver.
That's such a good point. Richard Louis is our big leader for the Moonshot. He said something very poignant, was that we as caregivers don't identify as caregivers until much later down the road when we are deep into it. But caregiving is anything from as simple as shopping, taking a loved one to a doctor's appointment, and then it just grows from there, especially with the aging population. We just end up bleeding into more and more activities. And before you know it, you're providing medications, you're changing bandages and things like that. So over time, it gets more and more involved. But it's everyone who's involved in care, is really generally speaking.
And the caregiver is the one who's often closest or there most frequently. They're the one who really does have that insight to knowing what's going on with the patient. Earlier this week, we were on a fireside chat with our board member, Dr. Toby Cosgrove, former CEO of Cleveland Clinic. And I was struck. You asked a really striking question, and there was a great dialogue and conversation, but it really signaled the gap as well as the opportunity here, which is it seems like there's no integration, a complete silo between, in many cases, the clinical team, the provider, even the primary care, and then the caregivers. And they're just totally separated. It's not integrated into the medical record. It's not integrated into the workflow. And you brought this up, and I was just sitting listening to this, and I'm like, wow, it's just totally disconnected.
Disconnected is an understatement. And I'd say they are caregivers, we as caregivers are underutilized, yet we have all of this knowledge that if you could unlock it, because we're so close to the loved one, it could be so powerful in so many different ways, not just better care, a healthy loved one, but think about utilization, think about capacity of our providers. All of these ED visits, my dad experienced it 4 times in less than 2 years. He went to the hospital for dehydration. If we knew that was happening in the first couple of hours, that he was becoming dehydrated, 4 hospitalizations could be used for those who are true emergencies, not a growing emergency that could be head off early. Those where there are accidents and emergencies. Think about the capacity you could do that on a broader scale. But yeah, the realization of how valuable and how important caregivers are, how do we need to arm them with the tools that allows providers, that allows payers to start seeing a steady stream of data so that they can be more proactive in the care and reduce those utilizations or visits.
So there's tens of millions of caregivers. I think the stat I saw was over 60 million, 63 million. Correct me if I'm wrong, but this is a big part of what's going on today. We're entering an aging population. This is becoming a really important issue, and you're bringing a big spotlight to it. Describe where we need to go. Describe how you're creating a solution to really take us out of this world of notebooks and faxes and scraps of paper and a disconnected world between the care team and the caregiver or the family, and how you're bringing us into the way it should be and what you're building.
Yeah. So I think in that fireside chat, I think Toby even said 30% of our population utilizes somewhere over close to 70% of our healthcare costs. Something, it was a staggering number. So if you think about that, it's a disproportionate, at the very minimum, it's a disproportionate amount of people are using a higher amount of our services, healthcare services. So in our perfect world, in our view, if a caregiver is empowered with our mobile tool, they can start tracking that information, sharing it with the care team. And now everyone's taking true proactive care. When something starts changing in a bad way, you can take action sooner. And now that action or that loved one is going to be healthier for a little bit longer period of time. They're not going to go to a hospital. They're not going to go to a living facility. It's just this cascading, it just cascades down to now you're giving our healthcare system they're not I don't want to say wasting, but they're not wasting money that could be used for other things that are serious, that are
And
emerging.
is that because you're simplifying or streamlining the process of how the caregiver can be a part of the care experience? Or how are you doing this? Describe, obviously, your mobile first, your AI first. Describe how you're doing that and what the solution looks like in practical terms.
In practical terms, our mobile app has 6 major categories: your physical care, your mental health, your care environment, vitals, and your medications. And you can pick and choose. It's basically whole person care. And you can pick and choose based on your care team, your doctor, whoever you're working with. And you can pick and choose those issues that you want to monitor. It could be your skin condition. It could be your speech if you have dementia, your swallowing, things like that. And now you track those every day or on a pretty regular basis. And now do we have menu-driven questions discrete answers, and then those answers are transformed into graphs and trend lines. They're visualizations. And now you can start seeing these trends over time, over a week, over a month, 6 months, a period of time. So you can start seeing the trends. And what that does is it allows everyone to see, number one, have a baseline of the loved one. But then more importantly, now because it's shareable, everyone sees what's happening in real time and can start taking action together. That's it's a simple concept, it's a simple idea, but very difficult to execute.
Well, I think simple and elegant is often the best way to do it because then people can actually use it and it gets the best design is simple, I think, where it doesn't even need instructions. So then does the caregiver or family member then take that visualization or that data and insights into, say, the next visit, or how does the integration happen?
Yeah. So picture, or I'll just give you a real life example. My dad would go to the doctor and they say, "So how are you doing?" And my first question would be, "How is he doing today, last week, last month, or the last time you saw him?" And that opens up, we don't have that much time to talk about it. But think about our app having these graphs and trend lines for the past 3 weeks, 3 months. Now you can start seeing it and you can zero in on the true issues that are happening. Or it might prompt other questions like, why did something happen over this period of time? What happened to his weakness in this week? So it really gives a better perspective of what's happened away from the purview of the physician or the nurses, but what really happens at home, because that's where a lot of the problems occur. It could be from a skin condition, someone going from flaky skin to a sore that
Hmm.
gets infected. They can start seeing that sooner. They can start asking about that a little bit deeper.
Now, I know you made a lot of progress in 2025 in terms of working with pilot programs and working in the real world to get a lot of amazing results back. Can you give a little insight to how those programs worked, what you learned, and then how going into 2026, what's coming next?
Yeah, so we're just finishing our pilot with Cancer Services of Midland in Michigan, and we had almost 200 participants in caregivers, and 85% of the caregivers who used our app recommended our app to other caregivers. That was very high. We're very happy with that. Other benefits or things we learned is that the number one thing they loved about it was it improved medication adherence and care plan adherence. And you don't realize how important that is. And you think that should be easy to continue. But there's so much going on in caregiving, they get lost in the fray of being a caregiver because it's so stressful and so many things are happening. So that's number one. And then number two, the sharing, the ability to share something remotely in real time with the care team, with family members, is just reduces stress. They don't have to make phone calls. They don't have to email everyone. Everyone sees what's happening. And that's just an automatic sharing. So that's been very exciting for us, those feedback points. And so we're finishing our final report in the next couple of weeks. So we're excited about that. And I think and we're going to continue this program with cancer services in the foreseeable future. Next year, starting early, is a pilot with a residential care facility. And the whole point of what we're trying to do is let's prove that this Caregivers Insight, or our mobile apps called Caregiver Views, is is useful at various different levels across that caregiving healthcare spectrum. So that's really exciting. See how it improves or helps their workflow. How do they manage what's happening in the facility? Does it change them? Does it provide them more time, saves them time, and things like that? So we're excited about launching that. And then ultimately, our future, we believe, is our app is great for caregivers. It's already been proven through our pilot. But the big question is, how do we get this distributed to them? Going door to door isn't the most efficient way. So now it's working with payers, Medicare Advantage, and those organizations that take full patient care risk. Because again, if we can reduce utilization, avoid unnecessary hospitalizations and doctor visits, I think that benefits everyone.
So you're meeting with payers now, you're meeting with these employers now, you're meeting with larger groups now that can distribute out and be a channel to
Exactly.
more families, to more patients more quickly, it sounds.
Exactly.
So hear that, payers, you should be reaching out to Christopher Jew here. And we're entering an AI first world. One of the conversations we were having earlier this week was about all the advancements to make things more streamlined, more efficient, more automated. I think of things like ambient listening. You have a whole roadmap in place, but how do you think about the future of where this goes and how streamlined and efficient this goes in terms of how you might be using AI to streamline some of these things for families?
Yeah, that is a very big piece of what our future looks like in terms of our product development. We'll start with the easy, low-hanging fruit. We already have the ability to take all of our visualizations and then put it into an AI. As simple as ChatGPT. I'm not that I'm recommending it, but any one of the AI services. And it could summarize and highlight what are the highs and lows and the things that are happening. But how about that's great at one level, but now you could use AI to help coach you about what's happening. And now you have this repository of all of these support systems and tools, not our tools, but how do you coach a caregiver that's never been trained to do this? Now that's the next level. And then obviously the ultimate is, can it diagnose? Can it narrow down? Can it focus on what are the real problems here? And what is it? Because of all this data, we've got a ton of data that could be used that in such powerful ways.
I always love talking to you about where you're going because, as you said at the top of the conversation, it's on a weekly basis. You're making progress and moving forward and innovating, and that's what's needed today. You mentioned Richard Louie. He's leading up with you the Caregiving Moonshot. This is an area that we're really shining a spotlight on this year as well as coming up in 2026. Tell us a bit more about that. This has been something you've been championing for this part of your career now, and I know it's so important and meaningful to you. Take us into the future, take us into your dream of the impact that we make together in really focusing on caregiving as in a larger sense. Obviously, there's the company you're building, but what more needs to be done across the entire ecosystem and across the whole healthcare system?
Oof. Richard and I have had some really good, thoughtful discussions, and he's amazing. He's done so much, and he's a caregiver. And the thing that we've both been talking about is this caregiving moonshot. We have really great minds here, and we have realized that we've got a lot of thought leaders in caregiving, from tools to support to all. It's a huge spectrum. Gosh, it's such a broad spectrum, a wide spectrum of thoughts of how to address caregiving. It's not disease state. Caregiving covers everyone. Um,
Mhm.
and so with these thought leaders, we could be the go-to for caregiving. It's knowledge, it's resources, it's how to address things. And I think that has far reach because nothing is out there that exists. It's so fragmented. Caregiving is fragmented, and everything that supports caregiving is fragmented. But the caregiving moonshot that Startup Health can do is now it can consolidate all of these important and valuable things out there to help caregivers.
And one of the thing I think is several of our moonshots I see as almost umbrellas or they integrate into every other moonshot, where caregiving is almost like one of the pillars that belongs within the Alzheimer's moonshot or within the diabetes moonshot. They're all very linked and need to be integrated in so many ways. And I love that approach that you guys are taking to infuse it into the other moonshots and other moonshot communities so that it gets recognized as an important pillar.
Yeah, it's almost a doorway. It's a doorway into care.
Yeah. Yeah.
Regardless of the state, you open the door and it's okay. Now you can talk about disease states, or you can talk about any number of things, but at least you open the door into healthcare as a caregiver.
Where do people get in touch with you? I know you're looking to meet payers, you're looking to meet industry partners, and you're also fundraising. Where do people reach out to you, and what's the best way to get in touch?
The easiest way is my email. It's cjue@caregiversinsight.com. And our website's www.caregiversinsight.com. Our app is available on both the Android and App Store if they want to just check it out. Right now, it's free to test and use. We're getting a lot of good feedback, but that's the first and foremost, easiest way. And I'm open to any conversations because this is an important place in healthcare, and it's only going to become more important with time.
Thank you for doing the work you're doing here. And we got to keep a spotlight on this because I agree. This is paramount. Time is of the essence. Every family is impacted by this at some point. It impacts all of us, and it's a big gap and a big need still. So thank you for the solution you're bringing to the world. And we hope a lot more innovators come into the arena here because this is a big need. Thanks for leading the effort on the Health Moonshot with Richard Louie and others. And I very much look forward to seeing you soon, probably at JP Morgan or one of the other things in San Francisco and Bay Area. See you soon. Any last words of wisdom to share? Anything else you want to make sure the world knows?
We're passionate about this. We've been doing this for 3, 4 years now. And caregiving is going to make a profound impact on everyone's lives, period. And we're here to support that.
Thank you, Christopher. Good to see you.
Good to see you. Thank you. Thank you, Unity.
And finally, an invitation to all of the extraordinary health transformers, whether you are a startup, someone building the future of health, or whether you are an investor, funder, or buyer of the solutions out there in the marketplace. This is an invitation to you to join the Startup Health member community. Learn more at startuphealth.com. Look forward to hopefully seeing you soon.